My name is Luca Costanzo. I am a medical doctor and I work in the angiology unit of Policlinico San Marco Hospital of Catania. We recently published a review on superficial vein thrombosis. First of all, I would like to thank my co-worker Marco Mangiafico, without whom this paper would not have been completed, but unfortunately cannot participate in the interview as it is outside Italy. There are currently many studies published that show what is the treatment in the acute phase of superficial vein thrombosis. However, there are very few data about the prevention of superficial vein thrombosis recurrence. Indeed, from 10 to 15% of patients may develop new thromboembolic complication after the treatment of the acute phase. So now the open question is, what is the appropriate treatment to prevent SVT recurrence? Of course, varicose veins are the primary risk factor, as they can be found at least in 19% of patients with the superficial vein thrombosis. So this disease is quite common in patients with varices. But there are also several other risk factors, such as overweight, such as advanced age, cancer, autoimmune disease, thrombophilia. But there is one thing that I would like to emphasize. The onset of a superficial vein thrombosis in a healthy vein is a situation that must be thoroughly investigated, as this situation often is an expression of an underlying disease, for example, cancer, autoimmune disease, or thrombophilia. And what about treatment? We have 3 clinical scenarios that can be afforded with the appropriate treatment. The first one is we have a thrombus that extends more than 5 centimeters, but it's far at least 3 centimeters from the deep venous system. In this case, the appropriate treatment, according to guidelines, is fondaparinux at 2.5 milligram daily for at least 6 weeks. The second scenario is a thrombus that is less than 5 centimeters in the extension, and in this case, but also is far from the deep venous circulation. And in this case, we just use anti-inflammatory drugs or stocking compression. The third one scenario is that we have a thrombus that is very near to deep circulation. I mean, for example, a thrombus or a great venous vein that is near to the junction, less than 3 centimeters. In this case, we have to treat the patient as with deep vein thrombosis with full anticoagulant therapy for at least 3 months. I can summarize the key ways from our review in 2 points. The first one is that superficial vein thrombosis is not a benign disease, since it's not free from complication, including the extension to the deep venous system and embolization at the level of pulmonary vascular bed. The second one is that ultrasound assessment is essential, as it allows the evaluation of thrombus extension that, as I said before, is essential to define the appropriate treatment strategy and the duration of anticoagulant therapy. And as I said before, there is a gap in the literature for secondary prevention of superficial vein thrombosis. For example, there is a recent study that is in press on the use of direct oral anticoagulant to prevent recurrent superficial thromboembolic events. And there is another ongoing trial on the use of mesoglycan, also for the prevention of secondary events of superficial vein thrombosis. This is, I think, the current research landscape in the area. We had to consider that most epidemiological studies were conducted several years ago, and many of these studies have several methodological limitations. And also, the diagnosis was essentially clinical. This may be underestimated the real incidence of this disease. I think that new studies using ultrasound could allow us for a better epidemiological definition of this pathology. And probably we could identify a specific population at risk for complication that probably could benefit from a more extensive anticoagulant treatment. And what about the anticoagulant treatment? We know that there are new drugs such as factor 11 inhibitors that are under study in some clinical setting, and the first set of data are very promising in terms of safety and efficacy. Therefore, I think that dedicated study on superficial vein thrombosis would be very useful.